Hi, very good morning, everyone. Today is 9th of August 2025. We are meeting in the morning, 9:30 a.m. Indian Standard Time. Today, we have a very, very important speaker and a very important topic. But first of all, happy Raksha Bandhan to all the sisters and brother on this day. I think we have a sister over here who will take the session to help all, not only the brothers, but everyone in the society, how to understand heart attacks, sudden heart attack, young heart attacks. I think a session which everybody is looking forward. We all are hearing everywhere in the news that what is going on. In fact, I was reading a newspaper yesterday where a person who had no heart problems, never had ever visited hospital, no blood pressure, had suddenly collapsed in a gym. So obviously we have, as a young people, we have questions: is gym good, not good? So all those questions will be answered by our esteemed speaker today.
Yes.
So today we have today we have Dr. B Vijayalaxmi. She's a professor and former head of the Department for Pediatric Cardiology at Shri, Jayadeva Institute of Cardiovascular Science and Research in India. She currently serves as a president of Indian Academy of Echocardiology.
Past president.
Past president, okay. And she has contributed significantly to all the research, educations, and advancement of cardiology and cardiac imaging. She's talking about sudden cardiac death in the young. And if anybody wants to come and ask questions, I would open this session for everyone. The session is live on social media, but they can come and join the session. You can ask questions in the question answers round. The meeting ID is 818-859-11572. I repeat, 818-859-11572. Ma'am, over to you.
Thank you, Saurabh, for your kind words. And, it's a pleasure to be here talking on the sudden cardiac death. Yeah. As you said, in the introduction, all over the media, we have been hearing the sudden death occurring. And it is so horrible that losing someone very young and very energetic, suddenly it is a shock to everyone. So here, I would like to start with William Harvey, whom we call as the father of modern cardiology or cardiology. And he described that heart is nothing but a pumping chamber. It is just 4 chambers, 4 valves, and 4 blood vessels. And then it just pumps the blood. But before the Vedas, that means the Vedas are the oldest scriptures in the world. And before that, in the Narayan Sukta, the heart is described so beautifully. They say that heart is like an inverted lotus bud, 9 inches below the throat, 9 inches above the umbilicus. It is the place of omnipresent universal God. And it is the center of all the blood vessels and oscillates in the chest on the left side. First, it takes the nourishment to self and then supplies the blood to the whole body. And now we know that when we do the angiogram, the first branch is the coronary arteries, which supply the heart, and then all the branches. In the center, Agni is installed in the subtle form of factor, that is the Amsha of universal Paramatma. And now we know that mitochondria is the seat of energy and then maintains the temperature from head to toe. We know that the moment the heart stops beating, the temperature falls and we become cold. And this subtle molecule installed in the heart itself is Brahman, Vishnu, and Maheshwara. And that is so apt because blood supply, when it is there, the body cells regenerate. When they are maintained, when the blood supply is maintained, and unwanted, degenerated, or cancer cells are destroyed, that is Maheshwara. The heart is the most harmonious and wonderful organ in the body. It beats for 80 per minute and that is 1,15,200 times. And then throughout the year, life and throughout the years, you just cannot calculate how many times the heart is beating. And it pumps about 5,000 gallons of blood every day. And the amount of energy required for that 5,000 gallons of blood to be pumped, with that, we can take Queen Elizabeth ship from London to New York and back to London. So you can imagine the amount of energy the heart uses to pump the blood, to keep our 60 trillion cells in the body live. And it is so amazing that every time it beats, the blood that goes into the 60,000 miles, that is like going around the world 1.5 times. And in spite of that, this, it never takes rest. Day or night, it continues to work. And that's because the heart possesses 1 lakh times more electric and 5,000 times more electromagnetic power than the brain. We all think that the brain is very, very supercomputer and it is very powerful, but in fact, the heart is more powerful. But unfortunately, friends, the sudden cardiac death have become the prime killer in the prime of life. It strikes like a bolt in the blue, and for nothing at all, for suddenly, no, from nowhere, the person falls down. And once he falls unconscious, and then, everybody starts struggling. And today, we have to realize that sudden cardiac death is defined as unexpected death from the cardiac cause occurring within 1 hour of the onset of symptoms in a person who was previously healthy or whose condition wasn't expected to lead to death. And that is strange. And it is really like a thunderbolt it hits. But here, this sudden cardiac death can occur due to two mechanisms. One is the cardiac arrest, which is the arrhythmic stress where the heart stops beating. The other one is the heart attack, where the blood supply to the heart, the vessel gets blocked 100%, that is the coronary arteries, and causing the heart attack. So, cardiac arrest is defined as a sudden and unexpected cessation of the heart's pumping function, causing a lack of blood flow to the brain and the other vital organs. The sudden cardiac arrest is the leading cause of death in young athletes. And you might have seen that people trying to join the police department or anything, the moment that they're running, they fall dead. And all this is happening, even the football players, every year we see them suddenly dying, and even the people going to the gym, we see them falling dead. And it estimates vary between somewhere between 1 in 50,000 young athletes or 1 in 1 lakh dies of sudden cardiac death every year. So that is an enormous number. And one of the commonest condition is the something hitting the chest. It is called as the commotio and here the blunt injury that causes the sudden cardiac death, and that occurs when something hard is hit on the chest, either the sports equipment or something else, or the players or the ball, and the condition does not damage the heart muscle. Instead, it changes the heart's electric signaling, and then the blow of the chest can trigger a ventricular fibrillation where the heart is just fluttering like this at 200, 300 per minute, and then it goes into agonal rhythm and the person dies with the asystole. And apart from this, you can see that such a thing can happen in other conditions also. So, how to make out? The coaches and the parents, they are taken unaware of. So, how do they make out? If they have a family history of sudden death in any other member, one should be careful. If they have the shortness of breath or the chest pain, they have to investigate. And if there is a history of fainting or syncope, the syncope or falling unconscious is one step short of the death. And that could be if we have unexplained and it is not due to the fasting or it is not due to anything else, then we have to evaluate the patient for the other causes. So I show you the examples. This is a 26 years old female brought to the emergency OPD in unresponsive state. The pulse is not there, BP is not recordable, and history of taking some tablets or medication for 3 days. And we were not aware what she was taking. And the ECG was recorded. And look at that. What do you see? This is called as the torsade. This torsade point means, it is a form of a ventricular fibrillation where it is going to be sudden death unless you give a DC shock and revert it back to the sinus rhythm. And invariably, this happens in the long QT syndrome where the QT is prolonged and then an R falls on the T and then that would trigger. And invariably, when the phone rings or the doorbell rings or some loud sound or the DJ music, these people will have a triggering of this sort of ventricular fibrillation, which is a polymorphic VT. And then that degenerates into ventricular fibrillation and death. Now we come to another condition. Brugada syndrome is a very rare genetic heart condition that can cause dangerously for irregular heartbeats, that is the arrhythmia, and potentially leading to the cardiac death or cardiac arrest. And here, primary cause of the genetic mutation affecting the heart's electrical system, especially the ion channels. And this electrocardiogram patterns are very, very specific. And here you can see that in the 35 years old person who presented with the syncope and the family history of sudden cardiac death. And then when we saw the ECG, this is how it looked. And this is the classical picture of Brugada syndrome. And once you have an ECG like this, you know that they are prone for the sudden cardiac death, and Brugada syndrome can cause the death in the young. So this is a 45 years old male brought to the with the altered sensorium and not in senses, and he was not a diabetic. He was a known diabetic and hypertensive, and the cholesterol also was very high. And look at the ECG; just it is moving like this without the P or QRS complexes, and this can happen when there is a hyperkalemia. So any electrolyte imbalance can cause this sort of cardiac arrest. And then here you can see that the tall peak T waves, progressive diminution of the disappearance of the P waves are very classical in this. This is another patient, 28 years old female, sudden onset of breathlessness. And then, when we saw that the patient had pulmonary embolism. This is another patient, 38 years old person, and who had the systolic murmur and the chest pain. You can see that there are deep T waves, in the dissectable T waves, and such deep T waves occur in the hypertrophic cardiomyopathy, and especially the apical cardiomyopathy, and that is the Yamaguchi variant. And this is non-obstructive, and this also can have a sudden cardiac death because of the ischemic zones are there in the fibrotic array. And this is a 45 years person came with the chest pain, and clinical examination was totally normal. And this is how the ECG was. And when we are wondering what it is, it turned out to be Wellen syndrome. Not many people are aware of the Wellen syndrome, because this Wellen syndrome criteria is the prior history of chest pain should be there, the chest pain with the normal ECG, normal or minimally elevated cardiac enzymes may be there, and then STT changes in V2 to V3, that is the isoelectric or minimally elevated, just 1 millimeter elevation is there. And here the tight proximal LAD stenosis was there in this patient. Now, from the cardiac arrest, we move on to the heart attack. The heart attack, when you look at the frightening data, it is terrifying, because it is as good as 4 jumbo jets crashing per day. We are losing that many people, and especially in the last 40 years, 4 times more heart attacks have occurred, and they have increased in the cities and the towns by 10%, and even in the villages, the increase is by 4%. And this, compared to the Western literature, it is 940% increase in India. And that is a warning signal for all the cardiologists and all the doctors and all the parents to be worried about. Now, coming to the heart attack in young adults are becoming increasingly prevalent with a significant rise in the cases among the patient up below 40 years. There was a time when the children used to bring their parents to for the heart attack 30 years back. But today, the elderly parents are bringing their young children for the heart attack. So here the heart attack patients are now in their 20s, 30s, 40s, and this trend is particularly noticeable all over the country and especially certain parts of the cities. And here, the cardinal symptom of any heart attack is the chest pain. The chest pain, invariably, it is described as a tightness, not as a pain, pressure or burning or heaviness, aching or strangling or choking compression. And if you think that only the pain will be there, no, the pain can be described in all these forms. Usually, it does not change with the position or the respiration. See, if it is a pleuritic pain that is from the pleura, when they take deep breath or sneeze or cough, it is increased. But this is irrespective of that, position doesn't change. And it is induced by exercise or emotions or eating. And that is the typical. And classically, angina lasts for 2 to 5 minutes, but when they develop heart attack, it lasts for longer. Classical angina is relieved by taking rest, whereas that even at rest, the pain is not relieved when the heart attack occurs. So the location is very important. Usually it is substernal and it may radiate to the left side, to the neck and the lower jaw. So many a times the patients, they go to the dentist thinking it is the toothache, but then it is the lower jaw and it never goes to the upper jaw. And then it comes up to the epigastric but never goes below the umbilicus. And it may be associated with the sweating, palpitation, giddiness, and fainting attack. So pain is localized to some area and it can go into the interscapular region and the left side. And one has to differentiate the cardiac pain from the non-cardiac pain, and that is very important. So what do you do when the patient comes with a chest pain? The first thing that you do is take the blood for the enzymes elevation and then do the ECG. If the ECG is normal, wait for 1 hour because the first ECG may be normal in a heart attack when they come very early. And then if it continues, then do the treadmill exercise test. If the treadmill exercise test, if they walk for 10 minutes and it is negative, that means in the next 4 years, heart attack occurring is 99.99% not there. So reassure them and it is a low risk and send the person back. And try to correct the any other risk factors if the patient has gone. If the ECG is abnormal, then look for the SCT changes in the leads. And then if the ECG changes occurs with the hypertension just at 3 to 6 meds, that means it is a global ischemia. The left main disease is there and that person has to be taken for emergency angiogram and the treatment must be given. And if the ECG is abnormal and the echo can be done, abnormal ejection fraction and the wall motion abnormalities, coronary angiogram, and if needed, PTCA and bypass can be done. So here, ABCD in cardiac arrest is important. A is aspirin or anti-anginal. B is beta blocker and control the blood pressure. C is control the cholesterol and say no to the cigarette and do not allow the patient to smoke. And D is for the control the diabetes and also the diet. And E is education and a regular exercise. This ABCDE is very easy and everybody should remember. So there are some angina equivalents. That means if the patient is diabetic and then it is not like a chest pain or a heaviness in the heart, and they will have angina equivalents, which are equally important, and that is the breathlessness on exertion or easy fatigue or global ischemia. They can have the belching and nausea. You might have seen the Hollywood movies where the person is flying and the pilot, suddenly starts belching, and then he starts feeling giddy, and that is the angina equivalent. That is showing that the person is getting the heart attack. The sites of secondary radiation are ulnar aspects of the left arm, and also the jaw and the neck and the at the back in the intercostal spaces. Now, this is the animated picture showing how the heart attack occurs. So, this is the cut section of the artery, what is happening inside the artery, and here outside, when the artery is blocked, the area supplied by that artery, that myocardium dies. And inside, when the atheromatous plaque ruptures, and that the platelets try to close it, and then at that time the thrombus occurs, and the thrombus will make 100% block and then causing the heart attack. And 25% of the deaths due to heart attack in our country are because of the tobacco consumption. And the tobacco consumption is a single important preventable cause of heart attack. And in women, not only the women are affected, to be born child also will be affected. And Baltimore study has shown that the child will be born with the right-sided heart diseases. And that's how we know it is very important. Anyone coming with the chest pain, you have to take the ECG, and the ECG, 12-lead ECG will show that there is MI. But here one hitch is that any angina pectoris, if the ECG is normal, don't think that the person is normal. It is not heart attack, but they can have 60 to 70, 80% significant block inside. So a person with a heart attack is like a house on the fire. The earlier you douse, the better it is. And hence, the earlier they reach the hospital is better. So, first 1 hour is the golden hour. Within 1 hour, if they reach, and we can dissolve the clot inside by any streptokinase or any other drug, at that time, the whole heart attack can be prevented, and all the muscle can be saved. Where the facilities are available, the patients are directly taken to the cath lab. My husband was taken straight away, and there we do the angiogram. Wherever the block is there, we cross it with the guide wire and with the balloon, open it up. And this is called as the PTCA or the balloon angioplasty. And we don't want the artery wall to collapse, so we put the steel mesh, and that is called as the stent. So here in such patient, lifelong aspirin has to be given, and the lifestyle modification has to be done. All the risk modifications have to be done, and the risk stratification has to be done for the future attacks. So this is a 40 years old man who was chewing tobacco and who was a diabetic, and you can see that 100% block of the right coronary artery is there. He had a bradycardia and hypertension. And so immediately we took him and opened with the balloon. Though the vessel opened up, it was not adequate. So put a stent, and this is how the result is. But ultimately, despite advising, he did not come out of the addiction. And eventually he died of another attack. So this is a 38 years old man who had diabetic, chronic smoker, and then he was a hypertensive. And you can see that how badly the whole coronary artery, right coronary artery is damaged, multiple ones, and then it was a stented, and this is how it looked. But all this, at what cost? And if they don't change their habits, later on they suffer again. So when multiple blocks are there in the right coronary, left coronary, and left main, in such patients, we have to go for the bypass surgery. Bypassing means you are bypassing the block and putting the graft from the aorta to the distal to the block. And this bypass, nowadays, it is done with the arteries, the radial artery as well as the left internal memory artery. They last for 20 to 30 years, and that's how we know bypass surgery in young is also recommended. So treadmill exercise test is done to rule out underlying disease and also to reassure the patient to go for the work after the treatment. Now, diet is extremely important to prevent the heart attack. So here you can see that the good cholesterol, HDL cholesterol is there when you do the regular exercise and take the vegetable oils which are zero cholesterol. And on the contrary, if the person is in the habit of eating non-veg, especially lots of eggs and beef and mutton, along with that food, the animal lard also comes, and that animal lard, it gets deposited in the blood vessels, and that is the triglycerides or the LDL cholesterol, which are the bad cholesterol. And apart from that, apolipoproteins are there. If they are lacking, then also the heart attack can occur in a young age. Now, coming to the fats, here there are two types, the saturated and the unsaturated fats. Generally, saturated fats are come along with the animal fats, and they are not good. Exception to that is the fish oil or the fish. They have the omega-3 fatty acids which are good for health. So except fish, all the other animal lards are not good, whereas vegetable oils are good. Exception is the coconut oil. Now, trans fats are very bad for the heart attack because the trans fats are nothing but the oxidized vegetable oil, and that is like a dalda, vanaspati, whichever is solid in the room temperature, and all the fried items like kurkures or the cheese or all these things, in the vanaspati are not good. Now, pizza is equally bad because a single serving of a plain cheese pizza equals to half day's worth of saturated fat. And three slices of almost popular pizza can deliver 690 calories, 1620 milligrams of sodium. That means high sodium content is there, and that will cause the hypertension. And apart from that, it contains 33 grams of fat. So you can see that it is a sure shot to become the coronary artery disease in the future. And eating the other bakery items, all of them, they have the trans fats, and as a result it is not good. So eating junk food leads to obesity, hypertension, high cholesterol, and heart attack. So that's how we know the food should be shunned right from the childhood, because today we have the cardio-diabetic syndrome in the children, and they are becoming patients of heart attack at a young age. And what is junk food? The one which contains trans fats and sugar and maida, and no protein, no fats, no fiber, no vitamins, and that is the junk food. And today the junk food is, directly it is ending up to the heart disease. And instead of that, we must take the lots of vegetables. Now it is proved scientifically that anyone taking 2 to 3 types of vegetables per day, the heart attack comes down by 28%. And as a result, the vegetables that contain the fiber, magnesium, folic acid, zinc, vitamin A, iron, and all of them are extremely good. And daily we have to take even the leafy vegetable, because the leafy vegetables give rise to iron. And anemia patient can have exactly the same symptoms as the heart attack. They'll have the breathlessness, they'll have the chest pain, they'll have the palpitation, and hence, to prevent anemia, the leafy vegetables are important. Now, coming to the most important part of the food, we should have at least 3 to 4 types of fruits every day. When we take fruits, they contain antioxidants, and these antioxidants, like the scavengers, they clean the oxygen free radicals which damage the blood vessels. And here 32% of heart attacks can be reduced by the taking the fruits every day. So fruits not only prevent the heart attack, they give good vision, good skin, and good red blood cells, and healing is better, healthy bones, and clotting becomes normal. Invariably, heart attack is because of the increased clotting, and that is normalized by the fruits that we take. And that's how we know it is very important. Especially the banana is good because it contains a antidepressant. Today, the depressed people, they overeat and they go into obesity. And there is a difference between the upavasa that we have in India and the diet that is done in the Western countries. The dieting, keto dieting is not good. Many people, youngsters are dying because of the keto dieting. Whereas upavasa that we do in India, we eat less and meditate, and that is good for health. And today, obesity is called as the mother of five deadly diseases: diabetes, high blood pressure, high cholesterol, heart attack, and Alzheimer's disease, provided they survive till the old age. And especially after Corona, 30% of the women and children, they have become obese because of the habits that they have become lazy, sedentary habit. So increase physical activity, regular 30 minutes walking every day in the fresh air is very important. But today, irrespective of class and the thing, most of the people, including the domestic servants, have become very obese because of the lack of activity. So healthy eating, be active, no smoking, no alcohol, because 20% of hypertension is because of alcohol. And alcohol, Saturday night syndrome, and also arrhythmic deaths are very common with the alcohol, the binge drinking. So reduce the weight and be happy. The exercise is very important. With that, we have a very good benefit because the feel good hormones are released. Especially if you do the Surya Namaskara daily, it contains 12 asanas, the health will be very, very good. And all activities are extremely important. Now, as Saurabh told, we have heard many people when they go to the gym, they suddenly fall dead. Now, physical exercise remains one of the best way of lowering the heart disease on one side. But the paradox is those who go to gym, they die suddenly. Why is it? That is because they take the energy drink and also the formula given there. And these energy drinks that they take, they contain about 60 to 70 milligrams of caffeine. And that caffeine is not good, and it causes anxiety, jitters, and headaches, particularly due to the high caffeine content. And more serious but less common risk factors include the heart attacks and also the liver and kidney failure. And especially some of the formulas can cause dependency, especially with the inclusion of the illegal harmful substances. That is, the banned drugs are added, and as a result, they become addicted to that. So other side effects are, the common with all these pre-working formulas, and some of the formulas are containing the banned drugs. Now, some pre-workouts may contain stimulants like, which can increase the heart rate and the blood pressure and potentially causing the heart attack. And as a result, the supplements are contaminated with some of the banned drugs. So the substance abuse can have a big toll on the youngsters, especially the marijuana, cocaine, and other drugs. All of them can end up with the something like real heart attack and occurring early. And all this is because the coronary artery go into spasm. There is an increased oxygen demand, endothelial dysfunction, that is the inner layer of the blood vessels, it goes into dysfunction. So the clotting occurs. The direct toxic effects on the cardiac muscle can occur with some of the banned drugs. And that's why most of the youngsters dying with sudden cardiac arrest are all drug addicts. And hence, this has to be dealt very seriously. This slide is from my friend Shiba Thakkar from Ludhiana, Punjab, and she has done treated the youngsters right from 20 years to the 30 years. And all these patients, you can see that either they were taking opium or the multiple drugs or the Red Bull and the hookahs and hash and all these things, the heroin, and all of them, they had these types of heart attacks or unstable angina. They were all treated, and in time, but those who do not come for the treatment in time, they die suddenly. So you can remember these are very, very dangerous things, and we have to be very careful. From the drugs, if we move to the stress, nowadays either the youngsters are sedentary, not doing anything, or lack of work, or overworking and getting stressed. And this stress, it can cause poor digestion, increased blood clotting, increased blood pressure, and ending up with the higher cholesterol and a heart attack. And the best way to overcome is the shavasana or sleeping well. Now, there are three types of stress. One is the eustress. All of us, when we want to do work, we have to have some amount of stress. That means the target is there, we have to reach that. And that eustress is good for every one of us to do ourselves and a better job. The stress is not good. That means you have not done the time management. You are worried. The target has come. You are not able to reach it. And I have seen my own student preparing for the postgraduate examination coming with the interval MI. And that is very bad. And distress is still worse. So, friends, let us all change our aggressive attitude to the progressive attitude, depressive attitude to the impressive attitude, and that can be done with the yoga and meditation. And today, scientifically, it has been proved that anger releases 400 times more catecholamines and cortisol from the brain, and that surge of catecholamines can cause the coronary spasm, and the patient can fall dead. And this can happen with any person who has got a lack of sleep as well as the who is overworking. So instead of becoming stress junkies, do the shavasana and sleep well. And after the corona, especially now, it has been those who are working from home on the IT industry people, we have seen that prolonged sitting for more than 3 hours can increase the risk factor of heart attack. And that is because there is the blood flow is impaired, endothelial function is disrupted, metabolic process is also affected, and the weight gain is there. And as of the truncal obesity leads to the heart attack and diabetes and hypertension. And if somebody is sitting for more than 3 hours continuously, they are bound to get the heart attack more. And here, more important is lack of sleep is also very important. You must have minimum 6 to 8 hours of good sleep or yoga nidra. If you have lack of sleep, then the problem is less than 3 hours sleep is bound to get a heart attack. And that is because there is a inflammation of the blood vessels, elevation of the blood pressure, and disruption of the heart electric activity, and then they can have a sudden cardiac death. Now, what is the mechanism of heart attack if the person is sleeps less? Invariably, it is a hormonal imbalance, and that hormonal imbalance can occur when there is a sleep is deprived, and invariably that increases the blood pressure and the heart rate. Inflammation can occur, and also the elevated blood pressure can lead to the heart attack, and the heart electric activities will also be affected, and that leads to the electric arrhythmias and then arrhythmic death and what we call as the cardiac arrest. And today, more and more people are becoming like a type A personalities. And it has been scientifically proved that anyone like the type A personality are bound to get more heart attack than the normal person. So these type A personalities are highly motivated, ambitious, driven to succeed, and natural planners who make lists and the goals, and the time urgency is that they are impatient and free floating hostility or aggressiveness, and they often are able to juggle multiple tasks, and we feel that they are superheroes, and within no time they are gone. We have seen this occurring with the cardiac surgeons as well as the cardiologists, where they are type A personalities. But then we have to think at what cost, because this causes the hypertension and also the heart attack more. And invariably, when you look at their faces, the face is always tensed, and then the teeth are clenched, the tongue is licking or the teeth grinding, and the facial sweating will be there. We have seen such young, promising cardiologists and cardiac surgeon also dying And today it has been shown that those who are aggressive, most of the doctors, their lifespan compared to the normal population, 4 years less compared to the general population. And that's how say no to the type A personality. And once upon a time, the women were immune to the heart attack because of the hormonal protection they had before the menopause. But today, the women are also aggressive. Women are also are trying to compete with the men, not only in achieving in success in life, but also in the bad habits like smoking, drinking, and taking the drugs. Now, this is a eye opener in the medical history. In 1990s, in Japan, the young women and the men, they started getting admitted with the heart attack, but the coronary angiogram used to be normal, but the heart was dilated. And this dilated the left ventricle, which was reduced pumping capacity, ejection fraction used to be 10 or 15%. It resembled the octopus trapped in the trap. And that's the reason they called it as the Takotsubo cardiomyopathy or Takotsubo syndrome. And when they had normal coronaries, no angioplasty, no bypass surgery, they didn't know what to do. And what they did was they made the patients do the Mahesh Yogi's transcendental meditation for just 20 minutes. And they saw that within 72 hours, the hearting pumping, which was less than 10-15%, it almost became the 50-60%, and the patient became normal. And that is the time when whole world came to know the importance of the meditation. So here we have seen that by chanting Om, the negative emotions like knee-jerk reactions and the anger, and significantly they come down, because these negative emotions can lead to the fight or flight hormones, which are not good for heart. So negative states of mind, including depression, anxiety, loneliness, anger, chronic stress, all these things can lead to the heart attack, and that can be prevented by chanting Om. And that is the way to do the pranayama, and that prevents the heart disease, it improves the digestion, and it increases the concentration and reduces the stress level in the body. So the pranayama is extremely important to relax the mind as well as the body. Now, the new thing is added, the risk factor, that is the air pollution. So current scientific evidence shows that air pollution aids to the development of progression of atherosclerosis, plaque, and it also builds up the artery wall and then causes the heart attack. Especially the particulate matter like 2.5 and 10 particles can trigger the heart attack by causing the inflammation and causing the clot. And that can be reduced by pranayama or breathing exercise, and where you feel much better. The other risk factor nowadays is the noise pollution. The noise pollution contribute to the heart attacks primarily through the impact on the body's stress response. So, and the, causing the heart attack. Exposure to the loud, sudden noise triggers and even congenital heart disease. I told the long QT syndrome can occur even without any congenital heart disease. This can lead to the stress hormones release, that is the adrenaline and cortisol, and that can increase the heart rate, blood pressure, and heart attack. And especially listening to the loud music as well, like DJ, and we have seen the people with the DJ also dying. So the loud music noise is not nuisance. If it was just nuisance, we could close your ears and be done with that. But today it has been shown that 5% of the hospitalizations due to the heart attacks were triggered by the high noise levels. The heart attack rate in places with the high transportation noise can be as high as 72%. And that means the noise pollution is very dangerous. And especially high decibel music, 60, 70, 80, 90 decibels, the loud DJ music can trigger the stress response and cause the sudden collapse with the heart attack or the cardiac arrest. And we have seen even the DJ themselves dying, or even those who are playing to the DJ music. We have seen in our state the people dancing during the marriage, or the person, the bridegroom garlanding the bride with the DJ music, just falling down dead. And that is very dangerous. So here, the NIMHANS has done a study where they have shown that by chanting Om, the blood supply to the limbic system comes down, and they have demonstrated with the CT angio that all these animal instincts and the negative thoughts and these things in the schizophrenic patient, they come down with chanting Om. And that's how the meditation has become very important. And in the West, that is the mantra meditation, has become very common. And with that, the heart attack and even the heart attack patient's recovery is much better. The stress management, pain relief, all are very important. And here you can see that it is very important to do the meditation. With the meditation, you can see that the brain, before and after, you can see the difference. The agitated mind, the electromagnetic waves are more with the agitated mind, especially listening to the loud music or anger or frustration. Whereas after meditation, it is cool and calm. So it lowers the baseline cortisol. It can efficiently treat the pain, reduces the alcohol consumption. Alcohol consumption can directly cause the heart attack or cause the cardiomyopathy, or it can cause the arrhythmic death also. And decreases the oxygen consumption by meditation, and decreases the alpha brain wave emission, and increases the resistance. And today we have seen that endorphins and neuropeptides released after meditation are 100 times more potent than the morphine injection that we give to the heart attack patient. And that's how we know. Today we talk about the brain, heart, and the body axis. Whatever is happening to the brain, that effect is there on the heart. If the brain is agitated, cortisols or stressors or sympathetic activity is more, or parasympathetic activity is more, and that will increase the heart rate or decrease the heart rate. And then the coronary spasm will occur, and the heart pumping will come down, the hypertension occurs, and then the person collapses. So here, the meditation releases the endorphins and the neuropeptides and makes us a very sthita prajna and a better person to live in this world. And hence, today meditation all over the world is very useful and practiced all over the world. On July 21st, yoga and meditation are done. Last but not the least, keep smiling, come what may. If you smile, laughter is the best tranquilizer which has got no side effects. And hence, today, more of the people who are agitated, not having sleep, not having enough thing, and having lots of stress, just learn to smile, because happiness chemicals are very important. Like dopamine can increase more when you do the good work, and then somebody appreciates that exercise, and especially meditating, running, and exposure to the Surya Namaskara, exposure to sunlight, the serotonin is released, and that oxytocin is released when you're kind and hug people, and when you give the things to the people and play with the pets. And then endorphins are released when you laugh, and especially whenever you exercise and do the meditation. And hence people think that healthy habits, healthy heart, and healthy life is difficult. No, in fact, if you it is not an uphill task if you are disciplined in your life and keep away from the bad habits and inculcate the good habits and change your lifestyle. You can be very healthy. Today you may think that most of the people, they are blaming each other. That they say the drug peddlers are doing this are they doing that, the school principals and the college teachers are not doing adequate, government is not doing adequate. All this should stop. We must know what are the wrong things, what are spoiling the hearts of the young generation, and it is the collective duty of all of us. We have to start working together to give the better quality of life to the younger generation, so that they don't die suddenly. So ultimately, I would like to end with the saying of the Upanishad, I quote, kindness in words creates confidence, kindness in thinking creates profoundness, kindness in giving creates love, kindness in loving creates health and happiness. So the heart beats well when you're kind, heart beats well when somebody is kind to you. So if you want to be healthy and be happy and your heart to beat well, then be kind and love everyone. Ultimately, I would like to say another quotation from Upanishad, which says, we are as our driving desires are. As is our desire, so is our will. As is our will, so is our deed. As is our deed, so is our destiny. That means once we have a desire, we make a determination. Once we are determined, we act according to that. According to our act, the karma says that as is our karma, so is the result, and our destiny also becomes better. So we have to get determination and dedicated work towards the good of the heart of the youngsters. And for that, I would like to say that this, it's like a plant. And in this, the plant, when it is moving, you can see that the leaves and the branches of the plant are like all that we are doing, like streptokinase, PTCA, transplant, bypass, everything. But that is not going to work unless the roots are better. What are the roots? That is the lifestyle modification. And with the lifestyle modification, when you do yoga, meditation, there is a bhava vikasa, mano vikasa. We become the evolved person, and that prevents the 5S. And these 5S are very important. One is the smoking, other one is spirit, that is alcohol. 3, it is the stress. The 4, sedentary habit, and 5, sleeplessness. And all these things can be improved with the spirituality. And that's how we know in Hindi say Jaisa and Vaisa Man, Jaisa Man, Vaisa Tan. So thank you very much for your kind and patient hearing. And if there are any questions, I'll be pleased to answer all of them. Thank you.
So much, ma'am. Beautiful words coming from a beautiful woman. And I think smiling is very, very important. Very, very important words coming from. So, smiling, yoga, meditation is something we all know that what drives the good health and the good mind. So, I would like to open the forum with question answers. I see a lot of faces. Dr. Bukhari, you have a question?
Thank you so much, Professor Dr. Brother Surab. I was out of country for the last 3 weeks and sorry could not attended it. And
No
thank you, Dr. Vijaylakshmi. Very nice lecture. And I have one question.
Yes,
and
sir.
one of the question is to you. At the last end, you covered the cardiac myopathy. One of my class fellow, when I was in second year MBBS, he went to the early in the morning walk, and when he was walking and jogging, he suddenly fell and died.
Yes.
At that time, we were unable to diagnose what is that one. One of our even in second year MBBS in my time was not about the cardiomyopathy. One of our professor of medicine told that he was suffering with hypertrophic cardiomyopathy.
Yes, sir. Yes.
Let me know, because cardiac arrest and all other symptoms you describe can give some symptom before attack or something. Is there any sign to detect such hypertrophic cardiomyopathy in young age? Because I have seen 2, 3, other than this, my class fellow, I have 1 or 2 other friends who died in these conditions. Thank you, madam.
Yes, sir. That's a very important and a very nice question. A hypertrophic obstructive cardiomyopathy or apical cardiomyopathy, I showed there are different types, varieties. get the triggering of the arthritis, and they all are the autosomal dominant trait. So they are inherited from the inbreeding in the family. So if the family has got a hypertrophic obstructive cardiomyopathy in somebody, the whole family, all the members should be screened with the echocardiography. The echocardiography very precisely tells how the interventricular septum is 1.5 times thicker than the posterior wall of the ventricle. And here what happens is, it is not the normal hypertrophy like the athlete's heart. This is the abnormal with the fibrous tissue. And as a result, this disarray of the fibrous tissue make the islets of ischemic cells, and then they get the triggering of the arrhythmia and then sudden death. This is one type. The another type is when there is obstruction to the LVOT, left ventricular outflow tract, when there is a activity and they are running and the heart pumps with the more vigor. When the contraction is more, this left ventricular outflow tract obstruction becomes more. Suddenly blood going into the aorta is stopped. And as a result, they get hypertension, they feel unconscious and they fall. And when they fall at that time, if nobody is there to revive, in both the types, whether it is a arrhythmic or obstructive type, that time, if nobody is there to give a thump and do the cardiopulmonary massage, and they will die. And that's how we know we are training the people, the youngsters, to give the first aid, that is the cardiopulmonary resuscitation, at least to give a thump and the cardiopulmonary resuscitation massage.
Thank you very much. Another question is that you mentioned the negative state of the mind.
Yes.
Also, one of the factors that can cause these
Yes.
cardiac. Can this one thing, negative thinking about anyone,
Yes, sir.
can this precipitate? Because one of my vice chancellor in King Edward Medical University, he was not only arrogant, but he all the time, and I saw him in before retirement, he collapsed and
Yes.
died. Is
Yes.
there any relationship with this negative thinking about you or about any person else can precipitate this one?
Yes, sir. Very, very, very important. This is exactly what I was trying to tell. And you have given the example of that. When they have the negative attitude, especially the anger and the revenge and the hatred, there is a surge of catecholamines from the brain. And the catecholamines and cortisols, when they are suddenly released, especially when they are arrogant and they try to take the revenge and hate somebody, and that time the coronary go into spasm. Once the coronary is going to spasm, blood supply to the heart is reduced. See, like, your transformer is giving electricity to your house. If the transformer itself is not supplying, what will happen to the house? It will collapse. And that's how the person, once the coronary is going into spasm, the heart stops pumping, and then they go into hypertension. And within no time, they lose the consciousness because there is a hypertension, no blood supply to the brain, and they die. And this is the reason you should not have any negative emotions. And even American Association of Heart, they have come out with the decision and the scientific paper where they are doing the that is the mantra meditation. Mantra is you are chanting something all the time. So two things cannot occupy the same place at the same time. If the anger is there, the mantra cannot be chanted. If you are chanting something, either God or something, your anger will not come. So the anger and the frustration, the negative thoughts, everything will be kept away. And that's how these people can prevent. And not only that, even if they have had heart attack, the recovery is better when they do the meditation. And the meditation is the one which calms down your mind, makes you get the endorphins, neuropeptides. I told you, they are more powerful than the injection morphine. And that's how we know the person can tolerate any pain, anything, and they can lead a better life. So the negativity should be shunned at any cost, because the whole world, universe requires the peace. And you can see the war comes out of the hatred, whereas the peace comes out of the peaceful mind where we start loving. And that's why I quoted the Upanishad: when you are kind, very concerned, loving and caring for everyone. Everybody is happy, and whole thing, not only the vice chancellor, the whole university students and the teachers, everybody can be happy. And that is the best example that you have quoted. Thank you very much, sir.
Thank you. Assalamu alaikum. Assalamu alaikum.
Salam.
Thank you so much, ma'am. So we have a concern which I was reading. There has been a public concern in the social media claims that the COVID vaccine is leading to a lot of heart problems, especially in the young men, including the sudden heart attacks and sudden cardiac arrest. From the medical and research perspective, what do you think we can answer these whatever myths or
I think this is the important question to be addressed, and let anyone who has a doubt in their mind, let them be off their any confusion. The COVID vaccine saves the life, and it does not take the life. The simple reason is the COVID vaccine that we have in India, they are attenuated coronavirus. They cannot kill anybody. The other virus is, it is the adenovirus, that is the common cold and cough virus. And over that, they have put the spike protein of the coronavirus. And as a result, and that also, nobody has died of the common cold or the common cold infection. And this is how we know our vaccine is not like an RNA modulated one like the Western one. Indian vaccines are absolutely safe. Not 1, 2, 3, 4 ICMR studies have proved that the vaccine is not cause for the heart attack. And more important than that is, what has happened is, during the corona, people started drinking more and they started abusing the drugs, and the obesity has increased more, overeating has become more. Many people lost their money and the property, and as a result, the depression is more, and all that is causing the heart attack, but not the vaccine per se. And more important than, if a child had a corona infection, the myocarditis, if it was there, that heals by fibrosis, and that child can have a cardiomyopathy and not the heart attack like what these people are saying. So actually, all the youngsters who are dying now are because of the sedentary habit. They are addicted to the mobiles and the screen. They are not sleeping well, and all those things that I have enumerated, they are the cause for their death and not the corona vaccine, because the WHO has told that more than 45 lakhs lives are saved because of the corona vaccine in India alone. And 58 countries we have given the vaccination, and all the countries are very grateful to us. And as a result, do not blame the vaccine. Blame yourself, your lifestyle, and the way you are conducting yourself. And I think I have cleared the confusion in their mind.
Whenever there's a sudden cardiac arrest, people have a tendency of talking about, yes, this is a vaccine, and I think that answer needs to be addressed. That question needs to be addressed.
Yes.
Dr. Angelique, do you have any question? Dr. Akhtar, Dr. Angelique?
Sharad, thank you so much. Thank you so much, Vijaylakshmi. It is excellent. Now I'm thinking, where is my chest pain, depression, sleeping? I'm worried now, very much worried. I was doing exam for the final year student, and they were not answering. I was getting very stressed. They are going to be failed. So now I'm very worried now. Thank you so much.
Great, doctor.
No. If the students are not answering, they should be stressed. Why are you stressed, sir?
So we have there's a question
online. That's a good satire.
So there's a question online. What precautions must one take with apical hypertrophy to prevent the condition is worsening?
No, nothing can be done, because it is the autosomal dominant inherited one. So we cannot prevent or change the thing. The only thing that to prevent the arrhythmic death, they can implant the automatic, the defibrillator can be implanted.
Thank you. Dr. Sajjad?
Yes, thank you very much, Swarab. And I'm sorry, Vijayalakshmi, I miss your all lectures because I was busy in academic work. But I'm keen to attend your lecture, and I just listen your answer about the sudden death. Uh, but my question is, I don't know, you must have already mentioned in your presentation. Uh, Actually, what I am observing, that the young people, those who are doing their proper routine work with the proper gym, exercises, and everything. Yesterday, we have lost a very energetic neurologist in Karachi. He was so fit. He was so fit. Maybe he is in 58 or 59, near about, or near to 60, but he is doing a full gym of every exercises, uh, and he did his clinic uh, uh, yesterday, Friday, Thursday night till 11 o'clock. Then he went to house, everything routine. Then he felt at 3:30 early in the morning some discomfort, and then suddenly he was serious, and then went to the hospital, and he expired.
Yes.
Similarly, I heard so many people who are in a very young age. They are not involved in any addiction, in any, I mean, what we call, you just have a proper routine diet, early sleep, good food, everything, walk or exercise. But even then, that guy gone. So, what is the reason? My opinion
Sir, I
is
will
that,
answer, then you can give your opinion, sir.
okay. Thank
Okay.
you.
So you asked,
Before
they are going to gym, they are very fit, and then why they die? And in
Yeah.
my lecture, I told invariably they drink the energy drink, which contains a high caffeine, almost 60 to 70 milligrams of caffeine, and that causes the arrhythmic death because the electromagnetic waves are erratic from the brain. And the
Caffeine.
second thing is,
What you
they
caffeine?
take the caffeine, sir. Energy drink they are drinking in order to do the gym.
Yes.
Invariably in the gym, the energy drink is given to them so that they are more alert. They feel that they are very fit and happy. So when you drink 1 glass of coffee, it contains just 5 milligrams of caffeine, whereas this energy drink contains 70 milligrams of caffeine, and that is not good for the heart. And plus, to have the six packs, they take the formula of proteins, and invariably these proteins are contaminated or mixed with the banned drugs, like how the athletes take for their improving their ability. The same way these people are taking these formulas, and they cause the heart attack. So in our country also, though they are looking very handsome, very good, with six pack, they die suddenly because of the banned drugs that are there in the formula. And apart from that, sir, I don't know whether in your country you are still having the akhada for the wrestlers. They are very strong. They worship to Hanuman, and they drink milk and then badam
Yes.
and halwa, and they are very strong. You have never heard of any person going to akhada dying. Why only the people going to gym dying? That is because of the wrong things that they are doing. And that the isometric exercises they are doing are causing more stress to the heart. And these are not good exercises. The talim that you do in akhada is good for heart as well as the body, and not the exercises in the gym.
But Vijayalakshmi, I remember in Pakistan we have a very renowned pahalwan, what you call, in akhada. And what you said, you are absolutely right. But that guy, which is very much renowned, and he defeated so many international.
Maybe Gama or Gunga or somebody.
Yes. One of them.
They were the
Tara or something. Yes. So he died in an early age. In a young age. How it's possible? As you said, that it's not possible.
No, sir. Many a times what happens is when they become very popular, and then money starts coming, they get into the bad habits of taking drugs. And that is common
your
with the
voice
film actors
gone.
or anybody.
Hello.
Yes, sir.
Just to add, like, I was talking about these news. So, like, one of the news where 29-year-old healthy man died because of sudden cardiac arrest, no alcohol, no smoking, even no probiotic, like no high protein diets also he was taking. This is one, and this is another one uh, uh, where recently 40-year-old gym person died. Uh, Again, no smoking, working out for last 20 years. He was being saved by CPR. So CPR is another very important topic we
Yes,
would like to
yes.
cover in the coming sessions.
Saurabh, every time such death occurs, I'm there on an average per day, 5 TV channels, they will interview me. So I know most of the time, the real cause is not told. They tell that they didn't have habits, but most of them, they would have done the partying the whole previous night, and that nobody tells.
So my
And
question
then,
is
yeah.
different. My
Yeah.
question is that we cannot stop what is going on in the world, and especially the gym instructors. They are probably forcing the young youth. They're telling that you need to take that because obviously there's a marketing, there's a big commercial sessions going on. What my question lies over here is that if somebody is having that problem, how can we save somebody? Like, what I remember what Dr. KK used to say, the difference between a pain in your chest, because what happens is when you have a pain in the chest, it gets ignored because people say you're doing a muscle exercise, it's a muscular pain. So I remember one Dr. KK used to say that when you have a heart pain, you cannot classify with a point on your chest. It is like where you hold the entire hand and your entire chest and arm is getting pain. And that is where you have to have an emergency.
Yeah.
Whereas you can point out a pain, that is
It is
when
a
you
psychogenic.
muscular pain.
No. See, if you press with the finger and it is painful, that is tenderness. And that is the muscular one. And that lasts for the whole day and 3-4 days. It doesn't. Whereas the cardiac pain comes for 2 to 5 minutes. The moment you take rest, it goes off. And if the person is able to pinpoint and show the pain and says, and takes the deep breath like that, it is a psychogenic. That is, they are depressed and they are worried, and that is the causing the pain. And if it is, as KK said, if it is a cardiac pain, it spreads over the shoulder, the arm, and the back, and the jaw, the neck, and the upper abdomen. So that is radiating, and while taking the rest, it disappears. And that is the way I have to. We have to distinguish.
If it gets disappear while taking the rest, like when
that
is
is the warning signal. That is the warning signal. That means that blood supply, the demand to supply mismatch is there. You are climbing the stairs, you get the pain, you take rest, it goes off. That means it is a warning signal that inside the coronary arteries there is 70-80% block is there. So go and get yourself checked. And such people, if they have the family history of early heart attack like Sanjeev Kumar family had, they never live beyond that. But all this can be changed. Like my mother's father had sudden death, brothers, sisters, all had died. But I did the angiogram for my mother. I treated her, controlled all. Then she lived for 76 years. So that means you can alter the risk factors and give a better quality of life to the people.
The death of the Jhara was again diagnosed due to hypertrophic myopathy.
Yes, sir.
That we discussed.
Yes, sir.
Great, ma'am. So another question is that once somebody has these issues, so one, what is a regular yearly test people should have for ruling out any cardiac issues? Second, if there is a pain, what is like ECG is one of them, probably echo is another one, TMT is another one, now whether it's a contrast, non-contrast. So all these questions is something which I think we would like to know the answers.
Yeah. See, what happens is if the family history is there, all of them, not only the one person, the whole family, all the members should get evaluated. And if they have got any risk factors, the diabetes, hypertension, high cholesterol, or hypothyroidism, or any of them, all the profiles must be done and they must be controlled. So like how on birthday you want to light the candle and blow it, instead of blowing, go to the person and get the whole body scanning done, and so that you are happy. And I told you, if the treadmill is negative for next 4 years, you are not going to get a heart attack. So that's how if there are no risk factors, if you are not doing any wrong things, if you are not having the bad habits, then you can get it done routinely on your birthday or before the birthday.
Okay, I think this is a very long session which can go on and on. We have a lot of questions. In the interest of time, we would like to invite ma'am again, I would say, not the end this session, but the continue this conversation for probably next month or whatever, whenever she's available. So I think it is already 10:45. We've already crossed 1 hour, 15 minutes. So thank you so much. I think we still have a lot of questions in the chat box, but we'll answer that questions later.
Sure.
I would like to thank you, ma'am, for wonderful, insightful, and a meaningful session for everyone. With this note, I would like everyone to thank you, and please tune again for next session. Thank you so much.
Thank
Have a
you.
great
Thank
day.
you so